My sister, once she had was diagnosed with a tumor. She had a tumor in her brain, so they had to cut, her head for the operation, right? And so right after the operation, like, I say 3 weeks later, because she didn't have no health plan, no health care, they put her in a nursing home. And then after that, a month later, two months later, she passed away.
And see, I think that's not right. I think in the world of cars, maybe we can say if you can't afford car insurance, you shouldn't have a car. I think that's reasonable. But I think that if you can't afford to handle a problem caused by a life circumstance, that you have an illness, I don't think that we should say to you, sorry, we're going to let you die.
So when I came to the United States to do a residency in pediatrics, to become a pediatrician, I noticed that when an ambulance pulled up to the emergency room door, that the nurse would often go out of the emergency room and they would stand outside the door of the ambulance, and the ambulance drivers would be showing them a clipboard with some papers on it, and sometimes they would bring the patient inside the hospital, and sometimes the ambulance would close its doors and take the patient somewhere else. And I was told that it depended on whether or not the patient had private insurance or Medicare. Private insurance obviously paid more, and the hospitals would turn away, literally, patients who didn't have private insurance.
About 17,000 don't have insurance, and they're also typically have incomes that are low. And so if you're uninsured, and if you want to see the doctor, it's intimidating because you don't know exactly what the bill's going to be.
So as we know, we have Medicaid for the lower income population, and I know, although people say that there are a lot of problems with Medicaid, there are a lot of good things that Medicaid does do. It does give people access to care. You take a hospital like Lurie Children's Hospital, the former Children's Memorial, we take care of a lot of children who are covered by Medicaid. These children often, although they have Medicaid, one of the big problems with Medicaid is that it really doesn't reimburse doctors as well as it should. In particular, it doesn't reimburse specialists.
Am I well insured healthcare? Yes, I am.
Am I insured? Yes. It benefits people who's fortunate enough to basically who's employed and who's fortunate enough to have some money to afford it.
Well, my girlfriend, we have to pay like $90-some a month. She get Humana health care. And because the health care that she get through the government, it don't cover. It only cover, I would say 50% right now of, like if she goes to a doctor or have to have surgery, it only covers 50%. Obama's trying to push for everyone to receive health care. I think it's a pretty good thing, everybody can receive health care because there's a lot of folks that, can't afford it. And if he's pushing to get affordable health care for everybody.
There's another study that I read. If you look at the two zip codes that are in our community, 60623 and 60624, that's North Lawndale and South Lawndale. About, I think, 158,000 people live in that zip code. Right now, I think it's about 70,000 of those people have Medicaid right now. We think that another 38,000 are going to be able to access health insurance that they never had before. I think every human being wants to be healthy.
Everybody gets sick.